The moment parents are told that their newborn has a hole in the heart, panic sets in. Or perhaps you are an adult who went for a routine checkup and suddenly the doctor says you have an ASD. The first image in your mind is an open heart surgery, a large scar, and a life full of restrictions. Though not every hole needs to be closed, and for those that do, we rarely need to cut open the chest. Hello, I am Dr. Rushabh Parikh. I am an interventional cardiologist specializing in structural heart therapies, which means I specialize in fixing physical defects of the heart. Today, we are going to talk about ASDs, VSDs, and PFOs and help you understand when to wait and when to treat. First, let's understand the geography. Your heart has a wall down the middle called the septum, separating the left side that has pure blood from the right side, which has the deoxygenated or impure blood. Sometimes a baby is born with a gap in this wall. A ASD or an atrial septal defect is a small hole in the upper chambers. This is very common in adults because it often gets unnoticed in childhood. The second is a VSD or a ventricular septal defect, that is a hole in the lower pumping chambers. This is the most common heart defect seen in babies. When you have a hole, blood leaks from the high pressure left side to the low pressure right side. This means it pumps extra blood into your lungs, overworking your heart. So, do we operate immediately? Absolutely not. Nature is actually the best doctor. In many babies, especially with small VSDs, the hole closes on its own sometimes as the child grows. We call this spontaneous closure. If the hole is tiny, often less than 3 to 4 millimeters, and the pressure in the lungs is normal, we just simply observe. We do an echocardiogram every 6 to 12 months to track the progress. If the child is gaining weight properly, playing actively, and has no breathing trouble, we can wait for years. In fact, many adults live with a tiny restrictive VSD their whole lives without needing any procedure. However, waiting isn't always an option. We decide to intervene based on 3 factors: size, symptoms, and the consequences. We need to close the hole if your heart is enlarging. That means if the leak is large and the right side of your heart swells up like a balloon. If we leave this too long, it causes permanent damage. The second is pulmonary hypertension. This means the high pressure damages your lungs. This is dangerous and irreversible if ignored. And the third is symptoms. For children, this looks like poor weight gain or frequent pneumonia. For adults, it's often breathlessness during exercise or unexplained fatigue. If we see the right side of the heart is dilating on an echo, it is time to act. This is where modern structural cardiology changes the game. 20 years ago, a hole meant open heart surgery. Today, for most ASDs and for many VSDs, we often use a device closure. Here is how we do it. We insert a small tube through the vein in your groin or your leg and not the chest. We guide a special device up to your heart. This device looks like a double-sided umbrella or a button. We open one side up and pull it against the hole and open the other side. It sandwiches the hole shut. This procedure takes about 30 minutes to an hour. There are no stitches, no scars on the chest, and the patient usually goes home the very next day. It is in fact a permanent cure, but very large or complex holes may still sometimes need a surgery. But the device closure is still the first choice for suitable anatomy. Now, we have one more condition called a PFO or a patent foramen oval. This is a flap-like hole present in about 25% of all people. Usually it is harmless, but in some young people who suffer from stroke or very severe migraines, this PFO might be a culprit. This allows a clot to travel to the brain. In these specific cases, we perform a PFO device closure to prevent future strokes. This is a simple life-saving preventive procedure. To summarize, a hole in the heart is not a death sentence, nor is it an immediate ticket to the operating room. Small holes often heal or stay harmless. Large holes can now be fixed with a buttonhole procedure through the leg without cutting open the chest. The most important step is getting a proper evaluation by a structural cardiologist to know exactly which category you fall into. I hope this information was helpful to you. Make sure to subscribe for more such content.